Hello there and welcome to Dr. Z's Health Education Project. In this video, I'm going to talk about age-related macular degeneration, also known as AMD. What is AMD? Well, let's look at the words. We have age-related, so we know that this happens in older patients. Macular, which refers to a specific part of the retina, which is in the back of the eye. And then degeneration, which is breakdown. So we know that this is an age-related condition resulting in breakdown of the macula. And I'll get into more details in a moment, but why do we care? Why do we care about age-related macular degeneration? Well, if you have AMD, you are not alone. There are about 7... Oh, my pen is not working. There we go. So you have 7 million Americans with some form of AMD. Luckily, most of these Americans do not have advanced macular degeneration, but they do have some findings. Unfortunately, about 2 million Americans have more advanced AMD. These are folks who are suffering from visual impairment, vision loss, blindness from macular degeneration. People estimate that with the aging population of the United States, this number is going to go from 2 million to about 3 million by the year 2020. So a lot of patients out there have AMD. Now let's look at the eye briefly and look at where macular degeneration affects patients. So if we look at this photograph or this cartoon of an eye, we have here the front of the eye. So imagine that I'm a beam of light and I'm entering the eye from this direction, passing through the cornea, through the lens, and then landing on to the back of the eye, the retina. So this structure here is the front of the eye. This structure here is the lens of the eye. And then way in the back here, this orange layer with these blue and red lines is the retina. And if I were to circle the center of the retina here, we would call that the macula. So the macula is a highly specialized part of the retina. If I just draw an arrow here, we'll just call this the macula. So that refers to the central portion of the retina responsible for the center of the vision. Now, as you may know, macular degeneration is often described in 2 forms. And I'll write those at the top here. We have, let's see, dry. And then we have wet. I'm going to leave wet macular degeneration to another video, and I'm going to focus in this video about dry macular degeneration. So if I were to take the macula, kind of magnify, zoom in on this area and put it on its side, you would see that the macula actually consists of multiple layers, and I'm going to draw them out here. We have this layer, which I'll call the macula itself. And then underneath that layer, we have a pigment layer called the retinal pigment epithelium. And for the purposes of this video, we'll call it the pigment layer. And then finally, deep underneath that, we have the choroid, which is filled with blood vessels, and which for this video, we'll just call it the blood vessel layer. So we have the macula, we have this pigment layer that's a barrier between the macula and then this blood vessel layer underneath. Now when we focus on wet macular degeneration, another video, this blood vessel layer will become more important. But for dry macular degeneration, it's more about this macula and this pigment layer. And what happens as we get older, debris starts to accumulate under the macula and in this pigment layer. I want you to think of this pigment layer as soil and the macula as flowers or plants growing in that soil. So this pigment layer serves as nourishment for the macula, and these macular cells, which are processing light and helping us to see, are also generating a lot of waste product, and this pigment layer helps process that waste and eliminate that waste. It almost also serves as a garbage disposal. And as we get older, that garbage disposal mechanism starts to fail, and some of that garbage starts to accumulate within this pigment layer and also underneath the retina. And I'm going to call these little yellow spots in this diagram. Let's put them, label them with white. We'll call these little yellow deposits drusen. So if you ever read or see about the word drusen, that's referring to these little yellow deposits underneath the retina, waste material that's accumulated underneath the retina. We call those drusen. They look like little yellow pebbles underneath the retina. And I can, if you watch part 2 of this video, you'll see actual retinal photographs with drusen. So over time, these drusen accumulate and they cause little bumpiness in the retina. And that little bumpiness distorts the retina and causes distortion in a person's vision. And I'll show you an illustration of that distorted vision in a moment. So this is the earliest form of macular degeneration, just yellow waste products or drusen that get deposited underneath the retina and cause distortion in the retina. Now, unfortunately, over time, this pigment layer starts to also take some damage and gets atrophy or degeneration. So let's see if I were to try to illustrate that. So you also have then atrophy or thinning of this pigment layer. So instead of being a nice thick layer of soil, let's say, the soil starts to get really thin and atrophic. And unfortunately, remember, the macula depends on that pigment layer for nourishment. So when you don't have a healthy pigment layer, when you have these waste products, drusen, as well as atrophy of that pigment layer, then the retinal cells start to get unhealthy, start to break down and degenerate, and unfortunately start to die. And we call that atrophy or atrophic macular degeneration. This is a more advanced form of macular degeneration. So if I could somehow, let's see, illustrate that the macula, instead of being, let's say, this thick, it actually gets much thinner and atrophy. So we'll draw a macula that's about, let's say, half as thick. So you get atrophy of the macula, you get atrophy of the pigment layer, and you get this accumulation of drusen, and we call that atrophy or more advanced dry macular degeneration. So that gives you a basic idea of what's happening in the earliest form and even in the more advanced form of dry macular degeneration. Now, who gets this? What are the risk factors for macular degeneration, or AMD? First, and we've talked about this one already, is age. Generally speaking, as we get into our 60s and our 70s, so I'm going to say age greater than 60 is a risk factor. So the older we get, the more risk we have of macular degeneration. What's another risk factor? Let's do another one, race. AMD, or macular degeneration, is much more common in Caucasian patients than it is patients of African or Asian origin. We don't know exactly why that's the case, but we do know that's a risk factor. Let's see if I can fit one more in here. And another one is family history. So if your mom or dad had macular degeneration, or your brothers or sisters had it, you are at much greater risk of having it. And the last risk factor is smoking. This is really one of the only risk factors so far that you actually have control over. We do know that smoking has toxins in it, and those toxins damage the retina, probably damaging that pigment layer, that soil layer that nourishes the retina, promoting damage and causing macular degeneration. So the big risk factors are age, race, family history, and smoking. Smoking being the only one that you can really control. Now I'd like to show you what a patient with dry macular degeneration, with drusen, is going to see in their vision. So here we have, on the left, just normal graph paper with vertical and horizontal lines. These lines are straight, and this dot represents the center of the graph. As patients develop the drusen under the retina, and then if they go on to develop wet macular degeneration, even more advanced, they will develop distortion in their vision. So you can see that these lines are bent and wavy rather than being straight. So if they were looking at a door or a window or a street lamp, rather than the street lamp being up and down, street lamp is going to look crooked or wavy. And these are some of the earlier signs of visual distortion in macular degeneration. Well, so I hope you have a better understanding of macular degeneration, and if you go on to watch part 2, I'm going to talk a little bit more about this condition and show you pictures of actual patients' retinas who have macular degeneration. So, see you in the next video.